The US workforce is feeling more burned out than ever before. And unfortunately, what some are calling the Great American Burnout might just be getting started. A recent study estimates that in the US each year, $125 to $190 billion are spent on the psychological and physical problems of burnout. Employees do not just feel overworked, they also feel their own well-being is being overlooked. A wide-ranging survey from 2018 to 2020 of roughly 400,000 employees found that 60% of people report that work-related pressure has increased in the past 5 years, and that 95% of HR leaders blame employee burnout for the inability to retain staff. Meet Kyla. She's been recently appointed as the Chief Nursing Officer at a leading academic medical center. The hospital has a high-performing team and culture, but Kyla is concerned with the continuing rise in turnover with both doctors and nurses. Clinicians are working long hours under high pressure, which creates the perfect environment for a high degree of burnout. Kyla recognizes that this problem is costing the hospital significantly, an average of $12 to $17 million per year of cost for the healthcare system, and this is simply not sustainable. Healthcare worker well-being is a national priority, and burnout levels are at an all-time high. This problem is accelerating and negatively impacting quality, patient experience, and clinician retention. Healthcare systems are struggling to retain clinicians due to burnout. The latest cost data from 2018 is alarming. It costs between $22,000 and $64,000 to replace a registered nurse. It costs approximately $500,000 to $1 million to replace a medical doctor. The total cost of clinician burnout? $6.3 billion. This sum reflects the cost of recruitment and replacement of physicians when they leave their position. Those who go into medicine know that it's a stressful career and that it's a lot of hard work. However, we are heading for a talent shortage in healthcare like never before. 1 in 5 registered nurses plan to exit the workforce within 1 year. 3 in 10 clinicians are considering leaving the profession due to burnout. And approximately 3 in 4 healthcare workers aged 18 to 29 are reporting symptoms of burnout. Clinicians want help, though they fear for their job due to the correlation of burnout and quality of care. We developed BAT to apply novel technologies in combination with advanced decision-making under uncertainty methods to enable healthcare leaders to see sooner and act faster to fight the burnout crisis. Preventing burnout is a far better strategy than waiting to treat it after it becomes a problem. At ASP, this is our founding principle. The biggest dangers to any organization are the ones you don't see coming. To identify potential burnout hotspots, we identify at-risk employees quickly by scanning for signals including stress, fatigue, empathy, and cognitive load. The BAT platform is built upon decades of first-hand experience with environmental scanning and research by world-renowned experts. BAT transforms an antiquated approach to burnout detection and progression into a dynamic, data-driven practice augmented by analytics and intelligence. Popular thought would have you believe that burnout can be remedied by a quick yoga class or mindfulness session before it is back to the grind, only to repeat the same cycle all over again. Yet a more enlightened approach has begun to emerge, in which behavioral psychologists and workplace experts are questioning the root causes of burnout and what can be done about them. Organizations that spot employee burnout signs before they go too far will be far more effective in interventions, resulting in greater levels of employee retention and well-being, as well as substantial cost savings for providers. BAT is an enterprise SaaS solution designed to serve the healthcare ecosystem by helping organizations to see burnout sooner. Now, we would like to share with you how BAT works. BAT leverages a 3-part iterative system that combines journaling, an AI engine, and an executive well-being dashboard. In the first step, employees will access our dashboard directly and submit a 200-word journal entry 1 to 2 times per month. These entries are then analyzed within our AI engine, which scans the language for specific, otherwise hidden behavioral signals. Employees will receive a monthly confidential personal dashboard that displays readings with leading indicators of burnout, and they can see changes in scores over time. For each organization, we develop a custom dashboard of leading indicators to measure wellness at a functional group level, which protects employee privacy, identify teams and departments with the greatest propensity for burnout, and identify root causes based on historical trends to understand how company events, internal communications, and organizational changes impact well-being. Kyla is determined to move from being reactive to proactive to help her team stay well. She is convinced that taking steps towards minimizing the risk of burnout before it happens is a necessary and prudent strategy. Kyla and the leadership team are seeing sooner and acting faster based on changes to the leading indicators measured in the BAT dashboard. She is reallocating existing wellness intervention programs more quickly to target nurses and doctors most in need. After just a few months of monitoring with BAT, Kyla is seeing potential burnout hotspots with data cuts by shift, floor, and specialty. And beyond just saving money, this new approach also demonstrates that hospital leadership is serious about staff well-being and is rapidly responding to issues to keep the team healthy and performing at the highest level for their patients. Desmond Tutu once said, "There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in." At ASP, we have a deep passion for burnout and have seen firsthand how it negatively impacts clinicians' lives and their ability to take care for patients. Burnout anticipation technology is designed to be anticipatory. It is designed to work upstream.